Hello! Now we travel down under, as my friend and great master dental technician Mr. Russell Young says. Australia is a destination to hear Russell give a lecture that is almost a legacy of his own clinical and laboratorial experience. Russell Young is DSD's international coordinator for the Australian and New Zealand region and has been at the forefront of dental technology for over 40 years, paving the way for the future of dentistry in Australia and New Zealand, along with his business partner Tom Friedman. Through Russell and Tom's many initiatives, Omega Ceramics Dental DST certified lab lead the way in dental technology and dental education in Australia. Being a qualified dental prosthetist and DST master dental ceramist, Russell works hand in hand with DST founders Dr. Christian and Dr. Francis Coachman as an integral member of the DST Scientific International Group. Both Russell and Tom own DST online, www.dstonline.com.au, which helps dentists and technicians worldwide to achieve their treatments using this great planning tool. Let's hear Russell Young presenting on the changing face of dentistry. See you in a couple of hours. Eu vou cortar.
Hey, hi there guys. Hi Joao, hi Rui. Thank you so much for the invitation to share my passion with the rest of the world. It's so kind of you to invite me. I remember when we were talking about it a few weeks ago, we were discussing what topic I might talk about, and I realized that there are just so many incredible speakers talking about an amazing array of things that one of the things that I could offer would be my experiences in the dental profession over the last 48 years. Yes, I've been doing it a fairly long time now. So I thought it would be a good opportunity to share with everyone. And if we think about it, no cost, no boundaries, just dental education is certainly an idea worth sharing, a great idea that you two guys have come up with. So congratulations. I hope that my presentation can do justice to your Congress. So here we go. Let's see how we go. So what am I talking about today? My topic is the changing face of dentistry. And I decided to call it that because really, since I've started as a young technician, dentistry has certainly changed. And what has it changed into is the question. It's really changed into a business. In the old days, dentistry used to be a dentist, a sign out the front with his name on it, doctor in front of it, and that was about it. You'd hang up your shingle and people would come if they needed you. Today, dentistry is a business, and strategic innovation and marketing are the two functions of business. So who am I? For the rest of the world who don't know me, my name is Russell Young. I'm a dental ceramist, and I have been since 1975, a dental prosthetist, DST master and lecturer. I have a partner also for 48 years, Tom Friedman. We run 3 companies, Omega Ceramics Dental Lab, All on 4, Lab Team Australia, and dstonline.com.au, which is an online digital smile design centre that is now affiliated with DST Planning Centre in Madrid. I'm very proud of that fact, actually. Where are we? We're in Melbourne, 5 Bond Street, South Yarra, Victoria, Australia. We have a lovely building, Digital Smile Design Centre, the home of amazing smiles. I like to think of it as, I've seen lots of changes in 48 years when I think about it. So really, I started off as a young 18-year-old and I started as a dental apprentice. That's what we were called in those days. And this really is a bit of a timeline of the technological advances over the last 48 years of my career. So when we first started, the materials that we were using were very basic. In fact, long pin facings, plastic crowns. We then moved into the very sophisticated porcelain fused to metal crowns, gold crowns, jacket crowns. These things were not highly aesthetic. They were functional. That's about the best you could say about them. And they were very difficult materials to use. Then also in 1980, around about that period in Australia, dental implants entered the scene, and that was a huge technological advancement, as you can imagine. In those days, it was a dream to implant teeth. Porcelain veneers were another watershed, I think, in my career, something that we really developed, Tom and I, into a business. We imported Mirage porcelain into Australia in those days, and they changed aesthetic dentistry. Of course, like many new technologies, a lot of people were saying, this is just not going to work, sticking porcelain onto a tooth with a little bit of plastic, it's just not going to work. So it's interesting when you adopt technologies at the very early stage. Sometimes you have success and sometimes you don't. But porcelain veneers were, and certainly still are today, an amazing success. As the years went by, I became more experienced. I became a dental technician or an experienced ceramist. And so for me, the holy grail was all ceramic crowns. And some of the early stages were materials like Cerastor and Dicor. And we know that the manufacturers are the ones that really drive the technology in dentistry. These materials were very promising, but they were weak and they were difficult to manufacture, and there were lots of problems with the early ceramic materials. In the also mid-80s came along CEREC, CAD-CAM, 3D printing, believe it or not, came along very early, but they were incredibly early stages of development and really didn't go too far at that stage. Now the big game changer really was the internet that came along in about 1985. And that really changed dentistry. In fact, it changed the world, of course, as we know it. So in 1990 to 93, the mid-90s, we had an explosion of all ceramic restoration. So with the failure of Cerastor and Dicor, the companies put more research into it, and we ended up with materials like Inceram, Spinel, all ceramic crowns, and they were very serviceable. And then along came Empress, and Empress really was the first of the all ceramic restorations that could survive in the mouth for a particular period of time. So we had also Procera Alumina that came along in the mid-90s, and that was really an amazing technological change because you could actually you could scan a die and have that information sent via email to Sweden, and here we are in Australia, so that information could come back via the internet, which enabled us to have a coping arrive about a week later in a box that we could put on top of the die, and it would fit, and we could build porcelain on top of it. It was an amazing technological advance. So after that, along came, I think, one of the most important developments in my career, which was the digital camera, because for the very first time it enabled me to take instant photographs, check my work, go back, redo it, take another shot, and it was incredible. And really today I'm able to share this presentation with you on the internet through the development of digital photography. So important. This little baby cost me $12,000 in 1999. So early technology can often cost you a lot of money, but it was probably one of the best investments I made when I think about it. Emax came along, and of course this was the next generation of pressable materials, and of course we all know the impact Emax has had on the world. After that we had Procera Zirconia, which was the follow-up to Alumina. Alumina was a good material, but it also was weak, subject to fracture, and then along came zirconia. Now zirconia has proved to be, along with Emax, two of the most amazing materials that we've been able to use very consistently and create restorations that last for many years in the mouth. Now for me, one of the biggest, and you can see some of the biggest changes in my career, I've put them in sort of bold letters and colourful letters. And in 2007 we went to Lisbon and the Marlow Clinic there, and we were trained in how to do all-on-4. We brought that back to Australia, and it's really changed the face of dentistry. in Australia. There's no doubt about that. So that was an amazing technological advancement, particularly for patients that were losing their teeth. And the iPhone too. So along with the internet, the iPhone or the cell phone or the personal phone, whichever you want to call it, I think has been a revolution in the world, because it's changed so many things, as you'll see with Facebook and Twitter, and the ability to communicate with one another, instantly make calls, communicate with somebody around the other side of the world, and it's all in your pocket. That was just an incredible technological advancement. And yeah, it may not be a dental material, but it's proved to be the advancement in dentistry that we really needed. So after the iPhone came along, digital smile design 2D. In 2009, I reacquainted myself with Christian Coachman. I had met him as a young technician in 1993 in Sao Paulo, and he introduced me to something new, something incredible, he said, that they've developed, and it was called digital smile design. And you're able to design a smile on a computer and show the patient what that design would look like before you started. And it was very accurate, and it was facially driven, and this was an amazing technological advancement as far as I was concerned. So this led to the next development. Around about 2015, we moved from 2D into 3D. And 3D now allows us to do the same digital design, but in 3 dimensions, print models, put mock-ups in patients' mouths, design cases, plan cases. This is just incredible that the technological advancements kept coming, and they're coming more and more frequently, as you can see from my little timeline here. CAD-CAM has become mature. Printing, milling, zirconia, all of these things have become very mature now. The technology is getting more advanced as the years go by, and it's just, the future is quite amazing. Skin, developed by Paulo Cano, was also one of those modern technologies that was using old concepts but using new technology to develop beautiful restorations. And full digital workflow in 2017 is really where we've advanced to now, where we can really make a restoration. Unlike at the beginning when I was an apprentice and I had to just use my hands and my knowledge in my brain and my eye to shape and form a tooth, today we can scan a natural tooth, transfer that information into a computer, and have a milling machine mill out a perfect copy of a human tooth. And we can place those teeth strategically in the patient's face and deliver an amazing smile. So these are some of the incredible technological advances that have occurred. And really, 48 years later, after I started as that young apprentice, we have amazing materials, techniques and technologies that I didn't have when I started. So, what are our challenges today? Of course, there's always challenges. In my day when I was young, the challenges were lack of equipment and materials that didn't enable me to do the dentistry that I wanted to do. Today, all of that is here, so I have no excuses, but I still have challenges, and we all have these challenges. And in my country, and I'm talking about Australia, one of our challenges, and I'm sure it happens, I've spoken to dentists and technicians all around the world, these challenges exist everywhere. And one of our major challenges is that it's a dwindling patient base in Australia. And what do I mean by that? Well, if you have a look at the graph on the left, you'll notice that in 1992 we had 5,500 dentists and we had 17.5 million people. And we move on to 2016 and we've had an explosion of dentists. We have nearly 22,000 dentists and 24 million people. So if you look at the graph, you'll notice that we've had a 39% increase in the population of Australia and a 394% increase in full-time dental practitioners. So what does that mean for the average dentist? Well, in 1992, one dentist had approximately 3,162 patients available to him per capita. And as in 2012, that had dwindled to 1,700, and in 2016, it is now down to 1,100. In the last 4 years alone, dentists have lost over 34% of their potential patients. And what I mean by that is per capita, per dentist. So 1992, over 20 years, we've had a decrease in 54% between 92 and 2012. But in the last 4 years, we've had a decrease of patients of 34% per patient. So it's really rapidly changing. And why is that? Well, there's just been an explosion of dentists within my country. The education system is just churning out dentists, and it's just far outstripping the population growth. So out of 1,122 patients, there's more challenges. Only 60% of people in Australia really go to the dentist on a regular basis and have checkups. So 40% don't have checkups. So if you do your math, you take away 40% of that 1,100, and really, effectively, dentists are left with 600 to 700 patients per capita. So now out of that, of course, it gets worse. Some interesting things have happened along the way, perhaps in the last 10 years or so, since the global financial crisis. Out of that 674 patients that we've sort of narrowed it down to per dentist, so that's what you have available to you per capita, we've had the rise of dental tourism. What does that mean? What problem does that cause? Well, that means that patients in Australia are thinking, well, dentistry is too expensive here. I will go over to Thailand, or I will go to India. I'll go to places like that and have my dentistry done. So that sort of puts pressure on dentists. It also reduces the number of patients that dentists have. And of course, Asian lab work affected me quite immensely, where the cost of Asian lab work would come into Australia actually cheaper than the cost of my materials for making my crowns here. So of course, the challenges kept coming. And these are business challenges. When you think about it, we now have more or less conquered the challenges of materials and technology and equipment in dentistry, but we have business challenges in dentistry. Corporates have come along, and I know in many countries corporate dentistry has become very popular. This, of course, buys up practices, drives down prices, and makes price one of the major competition points for patients. So this is just adding further pressure on dentists. The digital age of dentistry has also arrived. Now, is this a challenge? Yes, it is. It's a challenge because it requires further education, it requires change, and of course change is always difficult for people. So this is just another challenge, and digital dentistry is well and truly here now, and if you're not prepared to embrace it, then I think it's time you reconsidered your profession, because dentistry, the tipping point has happened, and dentistry is really moving into the digital age. There's no question about that. So, let's have a little look here. And my computer seems to have just frozen for a second. That's interesting. Let's play that. So there we go. So if we go back, I might go back here, and we shall redo this corporate bit. I wonder whether we can, yeah, we should be able to do this corporate bit again. So the challenges of corporates. Corporates have really come into the dental profession in the last perhaps 5 or so years, maybe a little bit longer in my country. And corporates have changed the game. They've purchased up practices. Dentists are selling as they get older towards retirement. And this is conglomerating dental practices, making dentistry really just a business and driving the price of dentistry down. And this is very difficult for dentists that are working in practices and they're wanting to provide top quality to their patients. So all of these are challenges. The digital age of dentistry has arrived, and this is another challenge for dentists. The challenge here is that it's change. It's new technology that you have to learn. It's new education, courses you have to go to, new equipment that comes along all the time. And it's tricky, very tricky. So it's another one of those challenges. Moving to digital workflow. That's I guess, the result of digital dentistry. So not only do we have to understand digital dentistry, but now we have to understand the digital workflow. So this is another challenge for young practices, but probably even more so for people of my age. Dentists that have been in the dentistry for many years are finding it really difficult to work with these new technologies, but also to understand the rather complex nature of digital workflow, that it will get you to the end result that we know that we've been able to achieve with analog dentistry all these years. So the rise of the machines can be very threatening to people, and it's something that we have to learn to overcome and move forward, because if you're not prepared to adopt and adapt to this new digital age, then you really should be thinking of getting out of dentistry, because dentistry is well and truly on its way to becoming digital. So these are some of the challenges of modern dentistry. There's no doubt about it. We have lots of challenges. So how do you succeed in this climate? So as an independent healthcare provider, how do you succeed? So don't worry. I'm going to give you some ideas on what to do. So we just need to think. This is the important thing. Think about what? So as a dentist, technician, or lab owner, the future is in front of you, and there's no question about that. So what future will it be? Will it be a future of quality, or will it be a future of quantity? What type of practice should I run? These are other thoughts that go through our mind. Quality practice. Will I run a quality practice? Will I sell my practice, become a corporate, and really just focus on quantity and try and make as much money as I can per item? Is that what you want to do? How do I compete with the low price point? These are all questions that dentists and dental technicians really are asking themselves as we move into this digital age, as we move into modern dentistry as we know it. Quality or quantity? So with all of the challenges that I've described to you, there's no question that we need to engage those 674 patients we have in the treatment plan process and increase our case acceptance. So we have to make sure that every time we see a patient, we look after that patient, we make sure that they understand our treatment plan, and that so the treatment plan that we offer them is ethical, but also something that they're prepared to embrace. So how do we do that? So people may not remember exactly what you did or what you said, but they will always remember how you made them feel. Major decisions in life are emotionally driven, and that's something we all understand very well. People don't buy products, they buy feelings. So we're going to talk a little bit about the business side of dentistry now and how it relates to running a successful practice. Dental treatment versus priorities in someone's life. Well, if you have a think about it, and major decisions in life are usually emotionally driven, what are the emotions that we experience with dentistry? Well, dental treatment on the left-hand side doesn't have a lot of fantastic things going for it. If you look at it, pain, injection, noise, expense, all of those things are what comes to mind when a patient thinks about dentistry. When they think about new cars, house renovations, vacations, shopping, plastic surgery even, those things are much higher up on the list because A, they can market them more effectively to the public, and also they have a much better emotional feeling for the patient, whereas dentistry is way down the bottom of the list. So we need to change that. How do we change that? We need to learn how to create an emotional link with our patient, because some of those advertising agencies are fantastically good at creating emotional links with other products around the world. So you need to change the patient's view from going to the dentist to getting a great new smile. So rather than thinking about, I've got to go to the dentist, I'm going to get a great new smile. That's one way of changing the patient's psychology. We need to overcome some of the patient's hesitations, like, how can I afford this? Is it really worth it for me? Can I get this done cheaper elsewhere, as we spoke about earlier? What will I give up to get this? Does my insurance cover it? All these thoughts go through the patient's head. They're not really thinking about the outcome, which is what we really have in our mind when we see our patients and when we prepare our treatment plans for our patient. So what is the emotional link? So really, if you think about it, one of the only really cool things from a patient's perspective about dentistry is the facial impact of the smile transformation. This is the emotional link. This is what we call the emotional link. I'll talk a lot about this as we move through today. Digital smile design creates the emotional link. This is my belief. This is what I have discovered over the last 4 to 5 years, and it's what I want to share with you today. So what is digital smile design? It was created by Kristen Coachman, as I said earlier, and DSD is a dental treatment planning tool which allows effective communication and diagnostics for more predictable outcomes. So that is the definition of what digital smile design is, but it's so much more than that. So it helps increase our case acceptance. So remember, these 674 patients you've got, you have to make sure that you're going to have a pretty high acceptance rate when you hand them your treatment plan. You don't want to have them saying to you, well, doctor, thank you very much. I'm going to go down the street and think about it. I'll come back, we'll see how we go. They're not the type of answers that you want to get from your patients. It's not the type of emotions that you want to engender in your patients. So with digital smile design, a patient can see the completed simulation of their smile before treatment, and it allows the patient to be involved in their own smile design, reducing their uncertainty and increasing their case acceptance. The design is unique to each patient, and patients are more likely to agree to a procedure that they can visualize. It enables you to bring the excitement of emotion of a beautiful smile to the patient before they undergo treatment. So how to engage your patient and bring the wow? So like anything in dentistry, whether it's learning a new skill, whether it's doing an endo, whether a filling, an extraction, all of it really is a skill, and you have to learn these skills. So learning how to engage your patient and bring the wow to dentistry is a skill that you need to learn. And this skill is taught to you in the DSD concept: patient management, smile design, treatment planning, digital workflow. All of these things are available in education all around the world today in the revolution that is digital smile design. So DSD creates the wow impression and the emotional link. So what DSD does for you and the patient is that it changes the patient's mindset from, how much will this cost, to I want this and I'll do what I need to get this. I don't need this right now, but I want it. I can afford it and I am worth it. These are the types of strategies that major advertising agencies use on patients to buy all sorts of array of products. So remember, patients don't buy products, they buy feelings. So you need to connect with your patient's feelings. So how to engage your patient? This is the interesting question. So improving the smile design process and transforming the patient and having the patient as a co-author of his or her own smile is a very important part of it, and something that we haven't really been trained to in traditional dentistry. I know I certainly wasn't. So when I learnt this technique, it was an amazing transformation for me, and it enabled me to connect with the patient in a more emotional way. Developing communication protocol that facilitates real and daily interdisciplinary dentistry. That's what digital smile design does through the digital ruler, through the 3D that we'll have a look at later. So we're able to bring to the mouth the measurements, the tooth positional movements that we really weren't able to in the past, to enable us to create the smiles that we really want, that are facially driven. And then finally, I think probably the key element to digital smile design is your ability to show the patient prior to treatment what the outcome will look like. And this has a profound effect on the patient, and it changes the whole ball game when it comes to the patient relating to you and being connected to you and being connected to your treatment plan that you're going to deliver to the patient. And we'll have a look at some of these techniques as we move through the presentation. So the main goals of the DSD concept, again, number 4, is to integrate technology and generate efficient and predictable clinical procedures. So whether it's orthodontics, orthognathic, whether it's restorative, digital smile design can pre-plan your treatment plan, enable you to show this to your patient, and move ahead with an exactness that can translate to the dental technician, to the laboratory, to the work that you're doing, to your orthodontic planning. And all of it comes from planning before you execute, the most important thing. So how do you actually implement DSD into your practice? And that's one of the real challenges that we've had in digital smile design over the last 6 or 7 years, is that people that attend the courses with Christian Coachman and other lecturers around the world are absolutely blown away by the possibilities of digital smile design. But when they go back to their practices, they find it very difficult to introduce. And one of the main reasons is that the staff just don't understand it. So one of the very important things, as you'll see through my presentation, is that you must engage your staff, train your staff in the concept of digital smile design for it to be effective in your practice. Otherwise, it will be a barrier. So team roles are so important. So let's have a look at the team roles. Well, a dentist, of course we know, is the major, he's the captain. He's the catalyst, the professional treatment planner, and the case executioner. So he's very important to the role in dentistry, but don't underestimate the role of the nurse. A quality dental assistant or a dental nurse is so important to every dentist in the world. And make sure you appreciate your nurse. It's a wonderful thing to do, and you'll get benefits that you can't realize in the long run if you look after your nurses. So a lot of nurses in digital smile design take before and after photos. They certainly, I know my nurse directs the patient's poses when we're doing this, sets up materials, retractors, composite, etc. Because a digital smile design is more of a, I guess, performance. So you have to have everything ready and prepared for the performance with your patient. And this is modern dentistry. It's not old dentistry. Hygienists are very important in the digital smile design world because I think of them as advocates or scouts. Because in reality, a lot of patients are scared of the dentist. And that's just the way it is. And sometimes they just want to get it over and done with. But they're more prepared to talk to their hygienists, and they'll chat about everything. A lot of hygienists tend to be ladies, and they tend to chat a lot about family and this and that. And so the patients tend to relax and be a little more comfortable. And they'll often ask the hygienist about their smile and whether it can be improved. So a hygienist is a really important part of the whole practice when it comes to digital smile design. And the hygienist can recommend to the patient that maybe the patient would like to see what a nice smile would look like. And the patient will go, wow, what do you mean? And we'll say, look, let's book you in for a digital smile design and we can come back and have a look at it. So that then leads to the reception and the front desk. So reception and front desk need to be trained in digital smile design. They need to be trained in how to relate to the patient, what sort of appointments that they're going to have, what is a DSD follow-up. Situations can change from time to time. Who catalogues the images, who sends the images out to the planning centre, who follows up on the appointments, who coordinates the patient, who concierges the patient really. Because remember, you've only got 674 of them, so you really need to look after every one of them and make it an amazing experience for the patient to be in your practice. So reception, they need to be trained. It's such an important thing. Practice manager, finance, costing, organisation, DSD advocate, website marketing. These are very important people inside the practices. And I know that a lot of dentists have small practices and they do a bit of everything. But if you use digital smile design, you've engaged your patient, then the conversation, as I said earlier, is not focused as much on money. It's focused on the result. The patient is prepared to make the purchase, and it's much easier for the practice manager to discuss finance. And of course, the dental technician, let's not forget him. There I am, slaving away as I have for 48 years, and I'm looking at a smile design, and I know exactly where I'm going. I know the size, the length, width ratio of the tooth that I have to make. I can see it in the patient's face. It's an amazing tool for technicians. It enables me to plan and design and to quality control the restorations that come through my laboratory. It has truly revolutionized my laboratory. So let's have a look at DSD and the steps. The first DSD consultation works like this. You take your images and video as a case history, and you need to understand digital photography. As I said, that's been one of the great advances in dentistry, digital photography. It's sort of simple, yet it's critical steps that you have to master. Tools of the trade. Well, here's a little synopsis of the things that I use in my everyday use now as a dental technician, as a ceramist, as a prosthetist. I use Keynote, PowerPoint, WhatsApp, Dropbox. They're my communication tools. I use the DSD Planning Center, or my company, which is DSD Online, which is a planning center. I have a digital camera. I have an iPhone, an iPad. iPad we use for the DSD app, which we'll have a little look at later. So the dental world is changing, as I said, every day. We're having these amazing new technologies coming on board. Digital photography requires that you take 6 or 5 photos, and of course it's on the Planning Center website if you're interested and you want to go and have a look. DSD photo protocol is there to see you need these technical photos, as you will see, to enable you to do a proper digital smile design. Video is very important with digital smile design. As you can see, these are iPhone handheld photographs of a patient that's had a mock-up, a DSD mock-up. And here we have stills from video, which are very effective, so we can use our camera function. Is very important to the dentist and the technician to understand, and our little phones that we have in our pockets now are able to do amazing quality videos that we weren't able to do when I was certainly starting out and understanding occlusion. So this helps us understand occlusion, it helps us design a smile, and video really gives us the motion of a smile. I think it's so important. You can see the patient in the top left-hand corner. She's discussing her smile at the beginning, and we can have a look at her facial expressions. And here she is with the mock-up in her mouth.
You could, but we won't. Anyway, so think about when you first saw it. What did you think?
It's amazing. Is that what I want? That's what I want, Russell.
Okay. And
You got it.
So you can see the patients are engaged, and the video will capture that engagement for you and enable you to use stills from that video to plan your digital smile design. Moving up from a pocket camera or an iPad, you can move into what we call a mini photo studio. Many of you have seen this type of setup around the world, a DSLR camera with some flashes off the camera and some bouncers. And this is my particular go-to for my mini studio. And then full studio for the serious dentists who will set up a full photographic studio workshop to get involved in digital smile design, or just modern dentistry, really. Modern dentistry calls for imagery. Why do we need imagery in modern dentistry? Well, we need to plan it, we need to excite our patients with beautiful images, and we need to share these images with the rest of the dental profession, interdisciplinary dentistry, share them with our patients, and our patients can then share them on, as you will see, with the rest of the world. So photography is an absolute essential tool for dentistry in the modern world. So how do I get started? I mean, that's the common question I get from so many dentists today who heard about digital smile design. They're excited about it. They want to get into it. They want to know, where do I begin? Well, I like to say to them, well, you really need to understand the patient first when it comes to digital smile design. So what is the typical DSD patient? So assessing patients for DSD, what do I mean by that? Well, I mean that there are three types of patients: additive, subtractive, and combination. And let's have a look at them. Additive is a patient where it's really simple. You can do just a wax up, a digital wax up, a mock up, and you can put it into the patient's mouth. And of course, people do this all around the world, and they've been doing it for a long time, but digital smile design changes it completely, as you're about to see. Wax up and mock up is recommended for an additive patient. Typical examples. Here's an additive patient, and it's a two-dimensional design done in Keynote. This is not a mock-up, but a two-dimensional simulation done very easily. It's a very good starting point to talk to your patient and discuss with your patient. But the most powerful thing about it is it's an emotional change for the patient. The patient can get to see what the potential is with beautiful teeth in their face. Here we do combinations of designs for dentists, so we can have a look at what a natural color would look like, what a warmer color would look like, and what a white color would look like in the same patient's face. Here you can see three similar views of, well, they're identical views of the patient, but the teeth we've changed as a simulation. And this is 5 to 5. We can also have a look at 4 to 4. Here I've removed the 5s, and you can sit with the patient. This is what I'm talking about, discussing with the patient their smile design, what you're planning to do for them, how much it's going to cost. These sorts of things can be much more easily explained to a patient with images, because patients understand images far better than they understand verbal explanations from dentists. And here we've slightly rounded the teeth. If we go back and have a look, they're squarer there, and here we've rounded the teeth off. Subtractive is the next type of patient. So what do I mean by subtractive? Here you can see the patient on the left. It has had dentistry most of her life, and you can see it's not really great dentistry. She has hated her smile all of her life, yet she spent thousands and thousands of dollars on it, and none of it was planned. So here we've done a 2D simulation on the patient, and we're simulating what a all-on-4 would look like for this patient, and that was the treatment that she ultimately went with. Here's another one, same sort of thing. And this is the type of designs that we send to dentists, and they get this from the planning center or from DSD online, where we can take those 6 images that the dentist has sent us, put them into a computer, and with the techniques that Christian Coachman has designed, whether it's in Keynote or whether it's in 3-dimension, here it's a simulation in Keynote, and we have designed the smile, and the patient can see what the patient is going to look like with a full extraction and a implant supported all on X or all on 4 restoration, and the patient is able to get a better feeling, feel more confident. But importantly for us, we're able to plan where the teeth are going to go. We're going to know how much alveolectomy to do on the patient. We're able to measure this far more accurately also today with the 3-dimensional scans that we've got. So today I'm touching really on the surface of digital smile design. We don't have enough time to go deeply into it, but I'm touching on the surface, and I'm going to give you a taste of what's changed and transformed my career over the last 6 or 7 years. And here are some of the results that we get. This is again a full extraction case and the final result in the patient utilizing digital smile design. So the third type of patient is an additive, subtractive, or what we call a combination patient. So this is a combo case where the patient's teeth are too long on one side, short on the other side, a lot of rotations, and you ask yourself the question, would it be better to do a 2D simulation here, or would it be better to put a mock-up in the mouth? It's possible, and this is where you need to assess the patient carefully, because you don't want to be putting a mock-up in the mouth of a patient that the teeth are going to look too big. If they look too big, the patient's going to run off down the street, and the next dentist will have 675 patients. So you need to be sort of judgmental in what you do, assessing your patients. Very important for the digital smile design concept. Here's a patient who is a combination case, and in this case we decided we would do a mock-up. And it was one of those ones that we could get away with the mock-up in the mouth. It still looked good, and the patient was happy with that. So that's a combination case, but we possibly could have done a 2D simulation as well. So there's the patient there, and there's the result. The key to this smile is looking at the 21, and notice that the 21 has remained where it is, and it's like a jigsaw puzzle. You leave one tooth where it is, and you add to the others and subtract from some of them. So the first consultation, we take digital images and video as a case history. DSD photo protocol, as we had a look before, is done, and then reception is going to book the follow-up appointment with the patient before they leave. Now this is this important part that I was talking about before, where the reception plays a huge role in continuing the momentum and the excitement and the emotion that's being developed with the patient that's just had their photos taken. They're about to come back for their mock-up. They don't know what's going to happen, and the reception has to make sure they get the appointments right and book the patient in with enthusiasm and keep the momentum going. It's so important to look after your clients, your patients, because remember, 674 of them, so there's not too many. So in between that first appointment of taking your records, whether that's your photos and your digital scans or your impressions, in between that, we have what we call the inter-consultation. And what that means is we're going to do the design. So the dentist can do the design if they're trained themselves, and you can get training in courses all around the world. Most weeks of the year, there is a course somewhere around the world in digital smile design. So here we can see on the left-hand side, a designer is doing it in Keynote, and on the right-hand side, we can see the DSD app, and that's something that we'll talk a little bit about. What is the DSD app? Well, the DSD app is an amazing new technology been designed for the iPad by Christian Coachman and Ralph George, and it's going to change the way we all do digital smile design, there's no doubt about it. We have facial analysis and interpretation. So what Ralph has done is he's taken a rather complicated method of doing digital smile design on a laptop, on a Mac, or on a PC, and he's put it into an iPad that enables you to take the photos and automatically calibrate the pictures, advance the smile design customization, which is all of these little buttons are in there to make it much easier for you to move your smile design around. You can save your cases on the cloud, and there's a community. And it's a very reasonable price to start off with digital smile design. So digital dentistry on an iPad is another innovation that is going to change the way we do dentistry. There's no doubt about that in my mind. So DSD 3D will be done by a DSD planning centre in Madrid and now controlled in Australia by DSD Online. So DSD Planning Centre, it's much more than beautiful smiles. And let's have a little look at a case study. So we'll look at Bryce and his emotional journey, and really it was an interesting emotional journey because he's a guy, and you know what guys are like. They're not always that emotional. Maybe in some Latin countries a little more emotional, but in Australia they're pretty reserved. So here's Bryce, and he came to the practice because his mother-in-law didn't want him to actually marry her daughter unless he got his teeth fixed. So as you can see here, Bryce is thinking, well, he's looking okay, his bride-to-be is going to marry him, why should he do anything about his teeth when she's quite happy with him? But the mother-in-law said, no, let's do something with Bryce's teeth because he's not marrying my daughter unless we do. So here we go with a classic digital smile design, and I'm just going to whiz you through these things because this is not really a training lecture on digital smile design. It's really just giving you a snapshot of what we can do and how we can relate this to our business model. So here's a DSD simulation. Once Bryce saw this, he was a little bit more convinced that this mightn't be a bad idea. And then he was able to sit down with me and we went over the results and what it would look like, and we could explain to him what we were going to do so we could show real results to Bryce. So this is a simulation for Bryce, and this was very good, but we convinced him that it would be even better if we could test drive it in the mouth, and we wanted to test drive it like most of the designs if it's possible. We'd like to test drive them because we want to have a look at them ourselves. So why do we do this? Well, of course, it's perceived value for the patient, motivation for the patient, and really the mock-up is one of the most important things of digital smile design. And it shows that you can deliver. That's the important thing. As I was talking before, the nurse is so significant in digital smile design. She has everything set up for the mock-up, what we call the test drive. And this is something that should be done very smoothly, and it's, again, like most skills in dentistry or in other endeavors, it's something you need to understand, learn, and practice. So the second appointment is the transfer of the design to the mouth, and we like to call it the test drive. So this is the digital smile design that we designed on a computer, and now we've taken it and we've transferred it into the patient's mouth. And as you can see, the patient is transformed aesthetically, and the patient is very happy. Bryce was going, wow, this is amazing. And this is one of the most emotional moments for patients, and particularly patients that have smiles that need to be transformed. The patient now is emotionally linked to you, the dentist. And that's what digital smile design does. At the end of that second consultation, we were able to explain the treatment plan. Bryce was going to be married within 3 months, and we knew that we needed crown lengthening on the 1-2 and the 2-2. As you can see here, the drawing suggests that the gingivas need to be raised 1.5 millimeters on both the laterals. So we needed to get Bryce off to the periodontist. It obviously was going to be more expensive and would take extra time. So the mother-in-law, looking at the mock-up, was absolutely thrilled and was prepared to pay the money. So off Bryce went to the periodontist and had the crown lengthening done, and zirconia crowns and bridges were designed and constructed. So notes are written, more photos are taken of the mock-up, and this enables the technicians to have the information that they need to construct the restorations. And at the end of the second consultation, the practice manager goes over the financials with the patient. Very important. So the finished case. So here he is, Bryce, with his new restorations. Amazing result for the patient. And of course, as you'll see through most of my presentation, I like to say, and this really, when I think back at the beginning, this was what was really missing. This was the missing link for me as a ceramist, as a technician. I often didn't know where I was going. But here today in 2017, DSD plans and guides my vision and your vision, the dentist, to the finished result, from the mock-up to the finished result, to the final outcome, which was the marriage of Bryce to his beautiful bride. And this was a very emotional moment as well for everybody in the family and the mother-in-law, and yet Bryce was prepared to share his photos with the rest of the world because he's so happy. He is emotionally connected to what we've done for him. And when I asked him permission to share his photos of his wedding, he said no problems and was happy to do it. And this is what you'll find. This changes the way you practice dentistry. There's no doubt about it. DSD helps to guide the dentist in the art of transforming smiles. So DSD is a plan. It's a guiding plan. Now, I work with dentists all around Australia, and I have the pleasure to work with some international dentists, and Andrea Shepperson is one of them. And digital smile design brings more to the table than just treatment planning, because, as I said, when the internet came along and the iPhone came along, the world changed forever. So now we're able to communicate with one another like we never could when I was a young technician. So now I can speak to Andrea on the phone in Auckland on WhatsApp. I can communicate via the cloud. I can communicate via Dropbox, Messenger, Facebook, and I can design on Keynote, or I can design 2D or 3D. So we like to call this online asynchronous communication. That's a term that Christian coined a number of years ago. And what that means is asynchronous communication means that I can communicate with Andrea when she's sleeping, or when I'm sleeping, or when she's busy, or when I'm busy. That communication that we have is instant, it's there. We can answer later on. We don't have to pick up the phone and answer when we may be busy. So this is what I call 21st century dentistry. And when we're doing digital smile design or digital dentistry, it's important that we're able to communicate with one another, because it can be quite complicated. Treatment planning, it can be quite complicated. So Andrea is also a DSD master and lecturer, and one of the finest dentists I've had the opportunity of working with over the years. We can communicate a DSD facially driven treatment plan from one country to the next. Using modern communication, we can do incredible things that we could only dream of when I was a young technician. DSD photo protocol, again, there's a set style and technique of photographs that you need to do to be able to put them into the computer. And these photos and STL files are sent to the DSD Planning Center in Madrid. And in Madrid, we have wonderful dentists that are trained in designing and planning. And so Andrea, although she's an incredible dentist and could plan the case herself, she's decided to use digital smile design 3D, which we call Nemo DSD. It's the software that we use. And so Andrea sent the images and STL files to Madrid. Madrid did the planning in 3 dimensions. So now, instead of a plaster model where I might wax up the teeth, we are now able to use digital algorithms of natural teeth and place those natural teeth in the patient's mouth by lining up the digital scans with the patient's actual CBCT scan, so we can align the model to the face and to the skull. And when we move the teeth in the face and on the model, they will be moved in exactly the same dimension. So it's a fantastic way of designing a smile within the patient's face. It's incredible technology, something that I would have I probably wouldn't have even dreamed of it when I was a young technician. So it's amazing where we've come with technology and science. So here for our patient Simon, we're able to have a look at what a correctly designed, correct length, occlusal plane, and vertical dimension will look like in Simon's mouth. So Simon was in fact a wear case. So he'd worn his teeth down, reduced his vertical dimension. So in this instance, we are doing what we call functional designing, where we open the vertical dimension and we're doing upper and lower arches. And in Simon's case, you can see with the planning that we can use in a 3-dimensional plan, we're able to work out where the crown lengthening should be and how much it would be, how much we would lengthen the teeth, and how much we would open the vertical dimension. And you can see here on the left hand, the upper has been done, and here the lower has been done. And Andrea deprogrammed Simon with a Coist deprogrammer, worked out the vertical dimension that needed to be open, transfer that information to the planning center, and they were able to place these digital teeth on the model and create amazing anatomy and occlusion that would be very difficult for a technician to wax up as accurately as this and in such natural algorithms. And we can remove the models and we can have a look at the lower, we can look at the upper, we can combine them together. We can do treatment planning that, again, we couldn't have dreamed of years ago. So this is amazing technology that enables us to produce outstanding dentistry and predictable dentistry. That's the one thing about it that I love. It's predictable. And here is the modern and the old. On one hand, Andrea and I, Simon's case we used for a DSD training that we did earlier in 2017. And here is the upper virtual wax up, and at the bottom is the wax up by hand, the old analog way. So second consultation is always the test drive, and here is Simon preoperatively, and this is the photo that we used in the design. And here he is with the mock-up, and the mock-up was derived from our digital smile design. And as you can see, it's a transformation for the patient, but now it enables Andrea to plan the case correctly and exactly. So motivational mock-up sells and validates your plan. Yes, selling sometimes can be considered a dirty word in dentistry, but it's not. Selling, we run a business. Dentistry is a business, and we need to sell our products to our patients. But you know, remember, patients don't buy products, they buy feelings. So digital smile design enables you to connect with the patient's feelings by showing them the outcome before you lay a burr on their mouth. It's an important concept. So here is the mock-up that Andrea has prepped through, and she's able to determine her prep thicknesses and prep design far more effectively because she has the final result sitting in front of her. Colour of stump will change, the colour of the all ceramic restoration, very important information for the ceramist. So this is an often missed photograph. The dentists don't deliver to technicians, and if you don't do this, we often don't know what restoration ceramic colour to use on top of the prep if we don't know what the colour is. So very important. Analog versus digital. 3-shape digital scan. So this is the digital phase of the analog. So we'll have a look, and in this case we compared analog and digital in the one case with Simon, and we found it with today's modern digital technology that the difference is very negligible, very, very close. But the digital offers you so many extra things that you don't get with analog. So here's our printed model, and there's the analog model on the lower mirror shot of the upper. So we've got two upper models there, and we were able to scan, or Andrea would scan the patient Simon's mouth and send that to us here in Melbourne, and we would print the model. And now we're able to go ahead with the restorations from the model. Emax layered veneers in Simon's case, because we were looking for a natural result, were created from the design. We knew exactly where the teeth should go. We knew the shape of the teeth. We knew the rotation of the teeth. We had the mold that we could copy. So we were able to predict the outcome. And here they are, the Emax restorations on the printed model, which is the digital dentistry that we're now doing. And here's the result in the mouth with Emax restorations. And here's a little snapshot of the case. So a patient that's a Bruxer that has worn down the vertical dimension on the upper and lower arch, and you can see Andrea has opened the bite with the Cois deprogrammer. A vertical dimension bite lift was achieved using the 3-dimensional treatment planning. Andrea was able to use that vertical dimension device and the lower printed model. She was able to then transfer that into composite restorations on the lower. I did the ceramic restorations on the upper, and they were sent to Andrea in Auckland, New Zealand, and she put and bonded the ceramic restorations and completed the composite restorations, and I'm sure you'll agree it's an outstanding result by an outstanding dentist. Andrea, well done. So DSD plans, motivational mock-up sells the case to the patient, and DSD controls your vision and controls the ceramist vision, particularly for the final porcelain product. So again, thank you, Andrea Shepperson, DSD Master and Lecturer, Auckland, New Zealand. Hope you're watching, Andrea. It's such a pleasure working with you. So well done. I look forward to doing many more digital smile design cases and courses with you in the future. So moving to the digital workflow. What we've just had a look at was a bit of a combination. It was digital, but we did some layering, so there was some analog, there was a bit of a mixture, because really what we're doing today is we're transitioning from the analog dentistry that I learned as a young technician, and I'm transitioning myself through to some digital and some analog, and now we're going to move into a total digital workflow. So let's have a look at how a total digital workflow would look. So the upper left hand, number 1 in the slide, you upload your photos to the digital planning center, scan your models or send the scan to the planning center, and as you saw with the first case, the digital algorithms of natural teeth can be placed into the patient's mouth. This patient's name is Tila, and she had congenitally missing laterals, cuspids in the lateral position, as you'll see, and so a smile that she really wasn't happy with. So we put that into the computer. We planned an ideal smile using the digital smile design concepts. As you can see, number 3 creates a facially driven smile design for your patient in Nemotex through DSD software. And then we were able to, from the pre-op, create a pre-op 3D design and merge it together. Now from that design, number 4, we're able to print a model, number 5. So these are the steps of digital workflow. So it's gone all the way through to digital workflow. We're able to do a transfer matrix and then transfer the design to your patient's mouth and enjoy a motivational experience that's second to none. This is an additive case. The results speak for themselves. The patient is incredibly happy. I like to say, welcome to the world of DSD every time we do this for a patient. It's so inspiring and it's so, just great to work with this as a dental technician and as a dentist as well. It just brings dentistry to a new level. So let's create some magic and let's have a look at how we could do a case completely digital all the way through. So here's Tila's preoperative position. As you can see, missing laterals, cuspids in the lateral position, and deciduous cuspids sitting there. So they were extracted, and we were able to put the teeth and design a rather complex design and change it, because when you look at this smile initially you would think, wow, that's going to be a little tricky, we'll have to do some ortho and stuff like that to get the results that we need. But once you do a design, you often will find things that you didn't think were possible, because once you sit down and plan something, you can see things that you just don't see ordinarily just looking at models, because here you're actually working in the patient's face. So this is what I'm talking about. I'm talking about the changing face of dentistry. I know it's a pun, it's an analogy, but the changing face of dentistry is bringing teeth to the patient's face. So we're not really now treating teeth, we're treating faces, and that's been one of the tremendous changes in dentistry, treating people's smiles, treating their faces. So here is a beautiful simulation, and this was done on Keynote by one of our master designers, and it's just a fantastic design and the patient loves it. She wants to start with treatment as soon as possible. So it's a motivational mock-up. This is our test drive. So we take that 2D and we put it into the mouth, and it's even more powerful and more effective. And you can see the patient's expressions when they're smiling, and the eyes smile as well. And here is the mock-up in place, and here's half the mock-up on and half the mock-up off. So the DSD 3D motivational mock-up enables you to plan and see where you're going. These are the digital models, and you can see this is a design where it's a additive, it's sitting on top, but she was really a combination case and we could get away with an additive, and we're able to plan for the dentist the preps, and the dentist knew where to prepare these teeth. So this is the type of 3D image that you would see as a dentist or a technician. This is not necessarily something you would show the patient. This is really for designing and planning, and we call it our 3D plan, three-dimensional plan. We're able to line it up with the patient's lower lip and the curvature of the face. We can check every single aspect of the design. We know how much crown lengthening we need. We know where to move that cuspid once we've extracted the deciduous teeth. We know how much to prep the cuspids. They'll need to be a little more aggressively prepped than you would normally think to achieve the result that we want to achieve. But all of this is done through planning, and planning that's easy to look at and easy to modify and play with on a computer. So, following this particular case, because it's going to be a digital workflow, not an analog workflow, we're not going to wax this up. We're going to actually mill the mock-up in this case. So with digital work, we have many materials that we can use today. We have PMMA blocks, polymethyl methacrylate, lithium disilicate, we have zirconia, ceramic blocks, so many materials available to us. And we're able to mill out beautiful fine restorations and use these to place them in the patient's mouth as a mock-up. Okay, and here we can see oops, my computer is taking its time. There we go. Here we can see PMMA veneers that are milled very, very thinly and placed on top. Yes, they're sitting on top of Tila's teeth. And they're able to camouflage what smile she has at the moment and create a beautiful smile. And they're very, very nice to be able to check and test where you're going. So it's like a test drive for you, the technician and the dentist, so you can figure out where this smile is going to go. These are very thin restorations, as you can see here. PMMA can be milled to very, very down to 0.1 of a millimeter actually. Very, very thin, and they can be placed on the teeth, and the patients can have a look at what the result potential is. So here is Tila with her milled PMMA. So we said yes, we like that, that looks good. There are some minor changes that we might make, but let's have a little think about Tila. Let's think about human emotion, because that's what digital smile design and what I was talking about earlier brings to the table. Because what digital smile design does, it taps into the 6 human needs, which are the emotional needs of a patient. So if we have a quick look at those needs, we can, and this is Tony Robbins, some of you would have heard of Tony Robbins, no doubt, many of you probably would have done his programs. And his 6 emotional needs, and the most important one is certainty. So certainty is, we all need certainty in our life. We need to know what's going to happen. We need to feel comfortable that if we do something, we know the outcome. And that's a very basic emotional need for human beings. Of course, if we knew what was going to happen every day, and every day was exactly the same, it would be rather boring. So humans also need uncertainty or variety in their life. So that's the second one. Growth is another human need, that we need to know that we're growing and developing. That's very important. Significance. And this is another DSD emotion. It's so important that we feel significant, and it's really hard to feel significant if you've got a smile that you're not happy with, a smile that you're putting your hand over your mouth, a smile that makes you feel bad. Every time you look in the mirror, you don't want to smile in front of a camera. You feel insignificant, and that's a very important emotional need that makes us whole. We need to feel connected. We need to feel loved by people, and that's a powerful human emotion that everybody has all around the world. And of course, it's hard to feel loved if you don't love yourself and if you don't love your smile. So these emotional needs of human beings are part of the reason why digital smile design is so powerful, because it taps into those emotional needs, and it enables the patient to feel good about themselves when they've got a lovely smile, and then it enables them to contribute in society as well. So digital smile design really is a powerful connector for patients. So let's have a look at these 6 emotional needs in a patient, and let's have a listen to what Anne has to say.
Hi, Anne.
Hi.
You're here to see us about your teeth.
Yes, I am.
So tell us a little bit about your teeth.
Well, I'm very self-conscious about my teeth, as you can tell. I always cover my mouth. I don't laugh. I don't smile. And I never want to be in a photo or anything like that. So I just thought I really thought I was going to have them all pulled out to have an all-on for.
Oh, how's that? How did you find out about that?
Through, how did I hear about it?
Yeah.
I listen a lot to 3AW, and I've read about it in the weekend papers. There's normally a little advertisement there for All on Fours.
I see.
So, and I listen to 3AW a lot, and I always hear about Bond Street Dental. So
I see. Okay, so good advertising.
very good advertising, yes.
Have you been to other dentists in the past, and what did they say?
I have in the past, and I've always been told that because of my crossbite, I would have to have orthodontics and I could never have a denture. So I've sort of lived with this and probably hoping that something will come along somewhere. And then when I heard about the All on Four, I thought, well, that's the way it's got to be for me.
I see. So basically you were prepared to have your teeth extracted, all of them pulled out,
Yes.
so you could actually look better.
Yes.
You can eat okay, can't you?
I can, but I can only eat on one side, really.
But you can eat.
I can eat,
function.
yes, I can function.
Are you in pain?
No, not at
No,
all.
not in pain?
No.
So you're prepared to pull all your teeth out?
Yep.
Just so you could look good,
Yes,
basically.
basically. Or have a nice smile.
Or have a nice smile. Yeah, to look good.
Yeah.
Have a nice smile. That's
Yeah.
what everyone wants. is
Exactly.
A nice smile. All right, well, look, thank you very much. We're going to try a few things and see what happens.
Thank you.
Okay, bye.
So let's have a look what happened.
How you going?
Good, thank you.
What do you think of your new smile?
I love it.
And there's the lens right there.
Yeah.
Okay. You love it?
Yes, I do.
And I believe your daughter's getting married.
She is.
And what will you be doing at the wedding now?
Smiling.
Okay, wonderful. And tell me a little bit about what it's been like living with the smile that you've been living with all your life.
Oh, but it's very depressing, and you just hide your mouth and cover your mouth whenever you laugh, or and I tend not to smile at all because of my teeth.
Right, right. Now, I believe you came to the clinic because you thought you might be able to get all your teeth pulled out.
That's what I thought, and that's why I've been putting it off, because I was petrified of that scenario. But I thought I have to do it, otherwise I'm just going to live my life very unhappy.
So you were willing to pull all of your teeth out to have a nice smile.
Yes,
Do you have a nice smile, Mary?
I do.
So there, I think you can see with Anne, it's a really good example of how powerful digital smile can be. The two videos were 20 minutes apart. We were able to put the mock-up in, and Anne's complete emotional state changed dramatically. This is powerful stuff. As dentists, you can be heroes for patients. It's an amazing profession that we belong to. And it translates into real lives and real people. And you can see here she's with her son and her daughter. And now she's doing something she hasn't been able to do for her entire life, and that's smile. So that's very powerful. Just bear with me one moment. Okay, we'll have to do a little cut there after I use the word powerful. We'll then move forward and we will move into the next slide. A couple of little hiccups. So let's get back to Tila after having a look at Anne and her emotional response. So Tila, of course, loves her smile as well. And here we record a patient's smile, we plan and design the smile, and we reveal the smile. So I like to call it a bit of a sneak preview. So 2D enables patients to have a little sneak preview of their smile. And of course 3D is even more powerful for the patients. So here we can see the pre-op on the left-hand side, the milled restorations that I showed you earlier in the patient's mouth, and the design phase in the middle. So as I said, DSD helps the dentist explain an often complex treatment plan with a single still image, because it's very difficult to explain some of these treatment plans to patients because they have no idea what you're talking about. So let's go back again and have a look at the design, and you can see Christian's digital ruler was an amazing invention because it enabled us to size photographs and work out exactly the changes that we're going to do. And the clinical dentistry was done by Dr. Lauren Fowler, a young dentist here in Marlow Clinic in Melbourne, and she's done a beautiful job preparing the case for Tila's restorations. which were designed digitally, and they were milled digitally, and here they are here, and they are sitting on the teeth, and you can see that the preps are now related to the final design. We knew exactly where we were going, and the final result, all digital. All we did was glaze them. They can be polished. In this case, we just put a glaze and stain over the top of these digitally constructed restorations, zirconia restorations. So this is total 3D digital workflow, monolithic zirconia, stain and glaze only. And as you can see, it has a certain quality about it, a certain naturalness about it that is all about the design. The total 3D digital workflow, monolithic zirconia, stain and glaze. And here she is with the finished restorations in her mouth. And I have to say there's a certain quality of these restorations that give it a natural look, and I'm sure you would agree when you look at that. The world of digital dentistry has certainly arrived. It is here now, so it's time to jump on board. As I said earlier, one of the barriers to digital smile design for many practices is training. The dentist will often go along to courses and be trained and come out very enthused and ready to go, and just very excited about digital smile design and what it would offer his or her practice. But going back to the practice, if the staff don't know anything about it, it's going to be a problem for you introducing it. So this is where we do what we call DSD on demand, and we go into the practices and we train staff in digital smile design. As you saw earlier, it's so important. This is actually a staff member. She's one of the nurses. And we often do this. We go in, we do the design on the patient. Here it is here. Patient presentation. We did a 2D simulation prior to going to the practice, and the staff, the nurses, the hygienists, the front desk, they all got to see this. They got to understand how a simulation works and what it does for the patient. And of course, you bring on the excitement. Everyone gets excited. You've got the camera, you've got the mock-up, and you go through the process with the patient. Here you can see the patient looking at the images, and she's really excited and she's smiling. So we call this DSD on demand. And the provisionals made the dentists be able to now do the case, do the crown lengthening, do the restorations. I like to say winter has come in dentistry. So when I was a young technician, the whitest colour we would choose, and in fact even that was often considered too white for patients, was B1. Today, OM1 in the classic Vita shade guide is often considered to be the starting point for young women. So we'd like to call it snow, and that's the fashion. And so modern dentistry, and as I said to you earlier, dentistry has moved away from treating teeth to treating faces. And of course we know about Botox, and we can't go into that. We don't have time to go into that aspect of facial treatment of dentistry. But young females are so involved in facial design today, either using augmentation, plastic surgery, Botox, fillers, makeup, you name it. Young women are particularly focused on their facial appearance today in this modern world, and particularly the world of selfies and computers and Facebook. It's so important to look your best. So most young people are choosing a very white colour to do the work. It wasn't always my preferred colour. I really like natural restorations, as you saw earlier on with Simon. Being a ceramist, that's sort of the way I think about it. But here we can see white restorations, if they're done properly and they're layered properly, and this is a layered case, not a full digital case. So I'm giving you the whole gamut of digital smile design in this presentation. Layered, natural, layered, white, and digitally milled restorations. So when you do these cases, it's so important for the dentist to do a train. Don't just bond the case straight away, because we're trying to do the best we can as technicians. We don't always get it in the right place. So you should allow time for the train. And here you can see the restorations, layered Emacs going to the mouth, beautifully designed, facially driven for the patient. And there's no surprises at the train. So DSD plans, designs, and controls your vision. And here are Michelle's restorations sitting in the mouth at the train. And here are her restorations about 4 months later after being bonded by a young dentist, a young dentist who's going to become very famous, I believe, because you're about to see some of the skills and techniques that he has in marketing. And his name is Deepan Durasamy, or Karthik, from Melbourne, Australia, and he's only been doing DSD for a short time now, but he has produced something that's really, really interesting. Because as I said, dentistry has changed. Dentistry has changed since 1969 when I started, and it was all about materials and what you could do and how you could make a tooth. Today, it's all about people. It's all about faces. It's bringing the excitement to dentistry, and it's really fulfilling what the patients want. So social media now has become the new marketing frontier with Facebook and Twitter and Instagram, these types of things. Patients are all about looking after themselves and making themselves look better. So Deepan found this particular patient who has over 300,000 followers on Facebook. She had a very interesting lady, and as you can see here, she had 2 million likes that year. And this lady went in 1 year and lost 92 kilograms, and she documented her journey on Facebook. So in other words, she's become a very famous blogger, and it's an amazing transformation. Her name is Simone Anderson, and you can certainly look her up as well. And she decided that the last thing she needed to do in her transformation was to do her smile. Deepan offered to do that for her, and because of that, he developed a social media following as well, because everything that Simone does, she blogs. Dr. Deepan didn't blog it, but Simone blogged it for him. And here's the transformation that happened with Simone. And here you can see her. This is what I call Snow White. It's a beautiful white smile. And here's her partner, and he has his natural teeth, and they've been bleached. So you can see it's very, very white, but it's not ridiculously white, and it looks amazing because it's been facially driven, facially designed with digital smile design, and beautifully constructed with Emax restorations. So white is the new natural. So remember now, we're moving a little bit out of the dental lab, and we're moving a little bit out of the dental surgery and practice now, and we're moving into the world of marketing. Marketing, as I said, you've got 674 patients. Competition is incredibly fierce out there. You have to learn how to market yourself and market your practice. And there are many, many ways of doing that, and I don't have time in my presentation tonight to go through all of that. But this is an important part of it. Social media, making sure that the work that you do is seen and shared with your patients to the rest of the world. So how did that translate for Dr. D? Well, as you can see here, the little red line, another patient, obviously looking at what Simone does on her blog, noticed that she had her teeth fixed. And you can see, if you just have a little read of this, that she said, wow, who did your teeth? They're amazing. I've been dreaming of a Hollywood smile. I finally decided to bite the bullet and do something about it. I saw Simone's Instagram profile and I noticed her smile. It was absolutely beautiful. So all of a sudden, Dr. D has a tremendous number of patients that are seeing his practice, that are seeing the work that he does, seeing the digital smile designs that he does, and now these patients go through their own journey. And this is a tremendous way of building your practice, a tremendous way of building excitement with your staff and with your patients, and they all get to share it if they want to. It's up to them. And I know, of course, we have there are marketing laws in many countries that are tougher than others, but as long as you're keeping within the guidelines of your country's advertising, this is such an important thing in modern dentistry. And it's so competitive, we need to be able to show our work in an ethical manner. This is so important. And as you can see here with our patient, Renee was able to blog about her journey as well. Every aspect of her dental treatment she has recorded, including her visit to the lab, including her visit with us, also what she did afterwards. And this is just a little story of her journey that she wrote herself and that no one prompted her to do. So this is an amazing marketing tool for the dental practice, and something that is happening more and more. So I spoke about the changing face of dentistry. This is how dentistry is changing all around the world. And of course this will change too. New things will come along and marketing will change, but there's no question that marketing, digital innovations, these types of things have been really the heart and center of the transformation of dentistry over the last 48 years for me. So traditional dentistry is outdated. There's no question about it. It used to consist of a practice, signage, and doctor in front of your name. That was traditional dentistry. It is gone. It is outdated. It is dead. Skill sets of a modern dentist in the 21st century. Our clinical knowledge and technical ability, well, of course, that's always what has applied, and that's always what will apply. There's no question. However, dentistry has changed forever, and it's not going back. Treatment planning and diagnostics are far more important than they used to be. Digital smile design will bring that to the table. Digital photography and videos, marketing and social media, digital dentistry and digital workflow, brand awareness, point of difference, communication and presentation, selling, patient engagement, motivation, business and management, staff engagement and motivation and training. So really, what you're looking at here is you're looking at all of the skill sets of a modern dentist, skill sets of a modern business, that dentistry truly is today, a modern business, but a wonderful business. The transformations that we can do for our patients are extraordinary, and we should be very proud of the profession that we are in. So João and Rui, thank you so much for inviting me on. It's been such a pleasure and an honor to be able to talk to all of the people around the world. And I'll just leave you with, again, Peter Drucker's quote, "Strategic innovation and marketing are the two functions of business." Changing face of dentistry. Thank you very much.